Okay, we're ready to start. Good afternoon, everyone. Thank you for joining the MPH MSBH Dual Degree Program info session. My name is Mona Wu. I am the Program Administrator for the Dual Degree Program in the School of Nursing and Health Professions and your moderator during this hour. You are placed on a listen-only mode. If after the presentation there is a question that hasn't been addressed, please type your question in the question box and we will try to answer it at the end of the info session. If we don't get to all your questions, we will email the answers to you afterwards. Now let me turn this over to Dr. Kelly Lengo, Assistant Professor in the Dual Degree Program. Thank you.
Thank you, Mona. Hi, everyone. Thanks for joining us today. So I'm going to just go over some of the highlights of University of San Francisco, the School of Nursing and Health Professions, and our MPH MSBH Dual Degree Program. And then, as Mona just said, save your questions for the end. So it's great to have you with us today. Let me tell you just a bit about the University of San Francisco. We have a long history of providing exceptional education. We're the oldest university in San Francisco, and we are actually the second oldest college in California. We have 5 different schools. We have a school of management, a school of law, we have liberal arts, we have education, and then we have our School of Nursing and Health Professions. And our Master's of Science in Behavioral Health and Master's in Public Health programs are both housed in the School of Nursing and Health Professions. We offer more than 100 degree programs, and USF overall has about 10,000 students spread across graduates and undergraduates. Our main campus is beautiful. We're located in the city of San Francisco, right in the middle of the city, and we're very close to Golden Gate Park. We also hold classes at our Presidio building in San Francisco, where many of your courses as a dual degree student take place. But we also do offer classes in our USF branch campuses as well as online. And I'll tell you a little bit more about some of those options as we continue. At USF, we are mission driven. We are a Jesuit school. What does that mean for you as a student who might enroll at University of San Francisco? So for centuries, Jesuits have advanced academic excellence in the service of humankind. Educating students of all cultures, beliefs, and capabilities, and particularly inspiring them to strive for social justice. Being mission-driven means that we train health professionals to be excellent practitioners and skilled professionals within the context of certain fundamental values. Throughout our curriculum, we challenge students to consider issues of diversity and social inequities, and then we provide training so that our graduates have the leadership and critical thinking skills in order to drive change. All of our programs within the School of Nursing and Health Professions are committed to preparing health professionals who promote equity and who positively influence healthcare quality, delivery, and access. And these values are run throughout every course that you will take at University of San Francisco. The dual degree program is part of the School of Nursing and Health Professions, as I said. And in this school in particular, we have more than 1,100 undergraduate students and more than 400 graduate students. So there are a lot of different graduate programs that are offered within the School of Nursing and Health Professions. And so here we've listed a few of these: the Master in Public Health, the Master of Science in Behavioral Health, our dual degree program. But we also offer a Doctor of Clinical Psychology, which is called a PsyD. We offer a Master's of Science in Health Informatics. And then outside of our Population Health Sciences programs, we have a Master's of Science in Healthcare Simulation, a Bachelor of Science in Nursing, a Master's in Science in Nursing, and then we also offer a DNP, or a Doctor of Nursing Practice. And one of the wonderful things about our school is that because we're dynamic, we have the opportunity to tap into the highest quality faculty, and we create a real interprofessional training program. So our faculty have degrees and expertise in public health, in behavioral health and social work, in nursing, business, health informatics, psychology, and law, among a lot of different other expertise. So let me first talk about public health. What is public health? There's a number of different ways that we can define public health. Institute of Medicine says what we as a society do collectively to assure the conditions in which people can be healthy. The World Health Organization defines public health as all organized measures to prevent disease, promote health, and prolong life among the population as a whole. And then there's also this wonderful definition from the Centers for Disease Control that defines public health as the science of protecting and improving the health of families and communities through promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious diseases. So when we talk about kind of what is the Masters in Public Health program at USF, well, the MPH equips our students with core knowledge across the various disciplines of public health. So these include epidemiology, biostatistics, environmental health, health policy, health program planning, management and evaluation, and social and behavioral health. In our MPH program offered at the University of San Francisco, if you were to do your straight MPH, not with the dual degree option, but just your MPH, most students will finish it over 2 years, and we offer kind of a couple of different concentrations. We offer more of a generalist program, and this is based in San Francisco at our Presidio campus. We also offer a concentration in policy, leadership, and research in our Sacramento site. And then we also have an online program, a fully online MPH program, which is asynchronous. So what that means is that every week you will have readings, you will have assignments, but those are completed just on a week-by-week basis. You don't actually have required times when you need to be sitting at your computer, for example. So if you complete just the MPH, you would do it typically over two years, which would translate into 2 classes per semester, and it's offered in what we call a hybrid format. Now, listen closely, this is very important. So all of our programs within the Population Health Sciences department, which includes the MPH as well as the MSBH, they're offered in what we call a hybrid or an on-ground format. So what that means is that week by week, you're alternating an online week of activities with an in-person class. So if my class meets Mondays, then Monday evenings I will be at our Presidio building from 5 to 9 p.m. for a core class, and the following Monday I will have activities and assignments and readings, perhaps team meetings that I'm having online. The next week I will be back at our Presidio campus from 5 to 9 p.m. that Monday. So the MPH is 45 credits total. This includes 8 core courses, 4 electives, 300 hours of fieldwork, and a capstone project, which is a written culmination of your time in the MPH program. Now let's turn to behavioral health. What is behavioral health? SAMHSA, the Substance Abuse and Mental Health Services Association, defines behavioral health as a state of mental and emotional well-being and choices and actions that affect health. AHRQ, or the Agency for Health Care Research and Quality, defines behavioral health as mental health and substance abuse conditions, health behaviors, life stressors and crises, stress-related physical symptoms, and ineffective patterns of healthcare utilization. And then the main health access organization defines behavioral health as the connection between our behaviors and the health and well-being of the body, mind, and spirit. So behavioral health is very, very holistic at its core. Now, how do we run our Masters of Science in Behavioral Health program? Well, first of all, the view that we take in the MSBH program is that individuals are part of systems in which each component of a system influences the other. And we really recognize that achieving better overall health requires attending to not only mental health conditions and physical health conditions, but also to factors that impact healthcare access and social factors such as housing and education. So in our MSBH program, behavioral health involves analyzing and understanding how human behavior is influenced by both physical and mental health, and how human behavior can improve our mental and physical well-being. So in addition to courses designed specifically for our MSBH program, you're going to take courses in clinical psychology, public health, healthcare informatics, and leadership. So let me go over the program logistics for the MSBH. Typically, if you were only going to complete the MSBH, so again, not part of the dual degree program, but you just decided you wanted to get your Master's of Science in Behavioral Health, it would be completed in 1 year. Your classes are, again, in this hybrid format. They're all done in the evening. They will start, almost all of them will start at 5 p.m. and they will go typically till 8 or 9. Some will only go until 7 o'clock. And it will be this hybrid format where you're alternating being on-site in person starting at 5 o'clock, and then the next week having online assignments, team activities, and such. Our MSBH classes are based at our Presidio campus in San Francisco. This program cannot be completed online. It does not have any courses that are only offered online. All of them are offered in this hybrid format, so you must be able to attend your in-person classes in San Francisco. The one-year MSBH program requires 34 credits total, so that's about 10 classes. It also requires 300 hours of fieldwork, as well as a capstone paper that is a culmination of everything that you've learned in the MSBH program. Okay, so I've just talked about the MPH as a separate program. I've talked about the MSBH as a separate program. Now let me go ahead and talk about the MPH-MSBH dual degree focus. So the program is designed for students who want to obtain an MPH as well as expertise in population health, but who also desire additional knowledge and skills to address behavioral and mental health issues that are gained from your MSBH classes. So it's appropriate for students who are committed to eliminating health disparities and working with vulnerable populations, as well as creating social and physical environments that promote health for all. In the dual degree program, you're going to receive a broad, in-depth knowledge base and toolkit, and it'll position you to design, implement, and lead evidence-based healthcare and community programs that are focused on public health issues with a concerted focus and expertise in behavioral health issues. We emphasize practice-oriented and applied skills and competencies across all of your courses. Now, on completing the dual degree program, you actually have 2 degrees. So you have both your Master's of Public Health and your Master's of Science in Behavioral Health. I was just helping 2 of our dual degree graduates from this last August work on their resumes, and you actually get to write each separate degree. So Cedric Jackson just graduated in August, and he is able to say Cedric Jackson Jr., comma, MPH, comma, MSBH. So why do students enroll in the MSBH program? So this is a quote from one of our students, Valerie, and this is a little bit about why she felt like this was a good program for her. So she said the focus on individual level health and how social, physical, and psychological factors impact health and well-being was a great fit with my interests. I feel the core content from public health courses, such as epidemiology, biostatistics, and global health policy, combined with the skills that I will develop in MSBH classes, such as applied research methods and communicating for healthy behavior and social change, will make me an excellent health leader. I plan to work at the community level, but having a background in epidemiology and biostatistics will provide me with tools that will set me apart. And Joyce, another current dual degree student, said, I've always understood that before I can become an agent of change, I need to understand the range of behaviors and motivating factors that contribute to why people do the things they do. And I also must be able to review and evaluate policies pertaining to the populations I care so deeply about. Through the dual degree, I'll develop the competencies I need to give others the opportunity and universal right to health and well-being that I so righteously believe in. So a few more points about the logistics of the dual degree program. So like I said, what you have to do is complete requirements for both your MPH and your MSBH because you end up with those 2 separate degrees when you're done. So the total program, the dual degree program, requires about 60 credits for completion if you're starting from scratch, right? So if you're entering USF, our graduate programs for the first time, it'll require 60 credits. And students are interested in this degree not only because of the skill sets they gain, but ultimately it saves you time and it saves you money over attaining these degrees separately. The usual path for completion of the dual degree is 6 semesters. So what that typically looks like is students enter in the fall, and you take classes fall, spring, and summer fall, spring, and summer for 2 years. We do require that you take classes over the summer, so this really is, it's a 24-month program. There are breaks between fall and spring semester. There's a long break of, I think it's 5 or 6 weeks, and then between spring and summer and fall, there is a break of about 2 weeks. So the way that you take your courses for the dual degree program is in this hybrid format that I've been talking about, where it's this combination of on-campus class time and these online course weeks. Now, there's also the possibility of structuring your coursework such that you're doing more of a combination where you're taking those hybrid classes, so you have to be on campus every other week for each class, while you're also taking some classes that are offered fully online. The important thing to note here is that all of our behavioral health classes have to be completed in this hybrid format at the Presidio campus. So if you don't live in San Francisco, then the dual degree program won't work for you. Or if you don't live in the Bay Area, we actually have students who do come from Sacramento, as far away as Sacramento. But you have to be able to be in San Francisco. It turns out to be about 1.5 times a week that you're going to have an in-person class in San Francisco. The online classes, we do offer a fully online MPH program, and so if you're interested in taking some of your classes online, then those would be MPH classes, and we will talk about that. But we do make that available to students, and sometimes you might find that during one semester there is one of your core classes available online, and you want to avail yourself of that option because it's more convenient for you, or you have something very special going on that semester. And so we are open to you taking some of your classes online, but the majority of your classes will be in this hybrid format, so you must be able to come to San Francisco. So like I said, expect to be on the USF campus, our Presidio campus, between 1 and 2 evenings each week for the duration of the program. All right, so you also are required to complete fieldwork, and as I mentioned earlier, the straight MPH course sequence or program and the straight MSBH program, each of those require fieldwork. And so what's nice here about the dual degree program, and this is one of the ways that it saves time and money, is that for the dual degree program, you only have to complete 1 fieldwork internship and 1 capstone paper. And so instead of having to complete 2 for each of those, for 1 for the MPH and 1 for the MSBH, you get to do 1 that counts for completing the requirements for both of the MPH and the MSBH degrees. Okay, so just 1. And this fieldwork internship is something that students are typically, they really look forward to. We work with you guys to really find an excellent site and preceptor and have a really positive experience. So you complete it as the 300-hour internship, and it will be done in some type of agency, and these agencies are broad. When you start to hone your interest in what your fieldwork site and setting and project might be, we work with you to help figure out where that can take place and help to connect you and support you in that, in setting up fieldwork. And so typically you'll complete your fieldwork over 2 semesters. Students start it in their 5th semester. They started in late January of essentially their last year, and you will take a fieldwork class while you're completing your internship in the spring, and then you'll also take a fieldwork and capstone class as you're still completing your internship during the summer. So it's really nice because you actually have a course that is running alongside your internship, and that's a really wonderful way. It's a wonderful learning opportunity because you're able to bring what you're learning from your agency and from your capstone and being in that behavioral health environment back to your class to share this and talk about it and learn from it with your peers and from your professors. And so, so this is a really rich part of our program. So your fieldwork does culminate in a professional quality capstone paper and presentation. You can think about this as a master's thesis, and we work very, very closely with you on your capstone paper. It is like we say, it's a professional quality, it's a high quality paper that you will write. So it's really good practice for how do you write a really strong paper in public and behavioral health. You also will do a 15-minute presentation on your fieldwork experience and capstone project at what we call Health Professions Day, typically in August, where everyone presents and your agency colleagues will come, your preceptor colleagues will come, you can invite your family. It's really a wonderful day to celebrate all your hard work in the program. So your fieldwork experience needs to have an emphasis on data so that we make sure that you're enhancing, improving, and honing some of those public health skills that you'll need to have on finishing your MPH, as well as gaining experience and expertise in the behavioral health field. And like I said, we work very closely with you to find that really good fieldwork site for you that really meets your goals as well as the program goals. Right, now, just very briefly, what are the course topics that you're going to focus on, right? So we've categorized your 60 credits into kind of 7 main course topics, right? So the first one is health leadership and interprofessional collaboration. So you'll take classes here such as health policy and leadership, ethics in behavioral health, and interprofessional collaboration and team building. The second area of your coursework is in behavioral and public health care delivery and systems. And these courses are complemented by extensive training in health education as well as health coaching. So they include things like chronic conditions, integrated primary care, foundational concepts in community health. Your third category of classes is intervention development and program management. So these include courses in communicating for healthy behavior and social change, program planning, management evaluation, and project management. Your fourth category is research and evaluation, and one note on this category is that, interestingly, as a dual degree student, you actually come out having taken more classes, and thus with a more enhanced skill set in research evaluation than what you would get from just the MPH alone or the MSBH alone. And so you're required to take at least 3 classes in this area. These would include biostatistics, epidemiology, and applied research methods. And then the fifth category is environmental health and health informatics. You will take both classes in both of these areas. And then finally, you're required to take 4 elective classes. These are offered by the MPH program, but they cut across our kind of programmatic focus areas. So there are classes, electives in health policy, global health, adolescent health, health economics, sexual health and public health practice, community-based participatory research, grant writing, all kinds of things. And these classes are wonderful because typically faculty develop an elective class and teach that class based on their own area of expertise and typically a topic that they're really passionate about. So for instance, I teach adolescent health because that's one of my areas that I've worked in forever and that I'm very committed to. And then finally, you will have your fieldwork and your culminating capstone document. So that's our kind of general categories of what your classes will focus on. Now, if you are a new student, so you are on the webinar right now and you're deciding whether this is the right fit for you at the right time, and you're ready to pursue and get your application in and go from there, these are points for you to note. So first of all, we only enroll and start students in the fall semester. Okay, so we don't start students in the spring, we don't start them in the summer. We only have 1 admissions time for each academic year. And so you would start in the fall. You want to plan for 6 semesters of coursework over 2 years total. And like I said, this does include summer. So if you start in fall of 2018, then you're going to finish up in August of 2020. Okay, we do allow some flexibility within that. It's 6 semesters is the minimum that it takes to complete the dual degree, but if you wanted to spread your classes out a little bit more because you work full-time or you have other commitments that just don't allow you to take all the classes you need in 2 years, then we do let you take an extra 1 or 2 semesters, such that you would have an extra fall semester and or an extra spring semester where you're finishing up your required coursework. The dual degree program does require 60 credits for completion, and then you do your field work in your last 2 semesters of the program. In terms of what would this just kind of practically look like? So if you were to start next fall, then the classes that you would take include Introduction to Community Health Concepts, Foundations of Behavioral Health, Communicating for Healthy Behavior and Social Change, and Biostatistics. And that's what your semester would look like. And that's a pretty good illustration of how each one of your 6 semesters would be set up, where you have a combination of behavioral health focused classes and public health focused classes. And we try and set up each semester for the dual degree students so that ideally you have one course that has a larger public health focus and one that has more of a focus on behavioral health. All right, now, if you are, if you're contemplating a dual degree and you're a current or graduating MPH student, then just a few points for you to think about. So you also need to start your MSBH classes in the fall of 2018. And the additional time it'll take you to complete the MSBH will depend on where you are in your sequence. Now, if you finish the MPH, if you're going to finish the MPH in August of 2018, so this next August, in 1 year's time, then it'll typically take you either 2 or 3 more semesters. You'll have 5 courses that you need to complete and 14 credits. However, you don't have to complete an additional fieldwork or capstone paper. Your MPH fieldwork experience and capstone will count for what you need for the MSBH. All right. So I'll work with you as the program advisor for the dual degree students to figure out what your course sequence would need to be. If you are interested in also adding the MSBH to your MPH, then as I show here in number 4, I please want you to answer these couple of questions and then email your responses to me. So what drives your interest in the dual degree program, and how does the dual degree relate to your career goals? Since you've already submitted, since you are already accepted into the program, we have access to your original materials if we want to go back to them. And then if you are currently in our MSBH program, but you want to add the MPH, so you would graduate with your MSBH next August, you would complete it, and you would begin your MPH classes next fall. And so you need to plan for 2 additional semesters of coursework, which includes 8 classes and 4 electives. And your additional classes would be biostatistics, epidemiology, environmental health, public health systems, leadership and administration, and 4 MPH electives. And so we'll adjust it based on your classes that you've already taken. Again, you don't need to complete additional fieldwork or capstone. What you did for the MSBH program will count for the dual degree program. So also, please see point number 5. That's really important. If you are an MSBH student and you want to add MPH, then you need to go ahead and answer these 2 questions and email them to me. Okay? Let's see. So just to kind of finish up, to talk about admission. So what do you need for your application? So first of all, we do have a priority deadline of December 15th. And so what this means is that if you get your application for the dual degree program in by December 15th, then you will have a response from us in January. So that's really nice. It gives you some more time to, really plan your life. So if you know that the dual degree is something that you definitely want to pursue, then I would highly encourage you to get your application in for that December 15th deadline. The regular deadline is May 15th. Right? Now, as a dual degree applicant, you must have a bachelor's degree. That degree can be in any discipline. And honestly, our students come from everywhere. So they may have a health background. They may have a background in psychology or sociology. You might have a background in hard sciences. Maybe you studied chemistry or physiology is an undergraduate. We also have students who are anthropology or archaeology majors. So really, students come from all places. All right. Now, for your new application for the dual degree program, you need 2 letters of recommendation. What's ideal there is that you have 1 letter from a professor, so who can speak to kind of how you are as a student, and then you have a 2nd letter of recommendation from a work site or an employer. If you don't have both of those, then that is all right, but that gives us the best sense of who you are and who you will be as a student and as a behavioral and public health professional. You also have to write a statement of your professional goals in a short essay and respond to 3 different questions. These are on the admissions website, and please do respond to each of those 3. Respond to them one by one is how we'd like you to do it. You need to submit your transcripts from all of your post-secondary schools. So after you finish your undergraduate or community college degree, then we need to see all of those transcripts. Sorry, after you finished your high school degree or diploma, we need to see all of your transcripts from undergraduate, community college, whatever it might be. Then there is an application fee of $55. As a webinar participant, you will get an email with a code where you can waive that fee, so that's nice. We often get this question, so just to let you know that you do not need to submit the GREs. We do that because we really take a comprehensive approach when we're reviewing applications for the MPH MSBH dual degree program. We're really most interested in learning about your work and your volunteer experience, if that's relevant, that's related to public or behavioral health, because this lets us really see that you have a demonstrated commitment to the field of public health and or behavioral health at your point of application. We also evaluate your whole package of materials for the application because we want to be confident that you're going to succeed in our program, right? You're going to be a student for a couple of years. There's a lot going on in your life. Our courses, they can be intense, and a lot of the content, you know, can be tricky. And so we want to be pretty confident that you're going to succeed in the dual degree program. And so we do look at your transcripts. We do look at the courses that you've taken. A number of our students have mediocre GPAs, and that by no means rules out your application. Like I said, we really evaluate you as a full applicant, and we look at all the different materials that you submit, which brings me to the other evaluation criteria, which is really important. And we really want to make sure that the dual degree, the program, the coursework, our program learning outcomes, that those are going to meet the professional goals that you have and that you outline in your essay. And so we really want to make sure that the dual degree program is a really good fit for you because it's a big commitment of time, of resources, of brain space, really. And so we just want to make sure that it's a good match and you're going to get what it is that you want out of the program. So, so that's pretty much, let's see, what I wanted to say. You can, probably most of you have been to our website already, but if not, if you go to USF, you look at the School of Nursing and Health Professions, then you will see the dual degree program listed there a couple of different ways. And then finally, we'll take questions in just a second, but then if you have additional questions or you want to talk further about kind of the program content, what the courses are like, is this the right combination of degrees for your professional goals, then please email me. And I will be more than happy to say we can have email communication, we can set up a video conference meeting. If you want to come and meet on campus, then I'm always happy to meet our applicants. So really, any questions that have to do with kind of the substance of the program, then contact me at kleangle@usfca.edu. Now, if you have other kind of more general questions about admissions, about how do you submit the application, you have a question about your transcripts, whatever it might be, then please contact our admissions team. And you can contact Tamara White at twhite3@usfca.edu. And thank you very much for participating. We will now take questions. So I think, Mona, are you gonna moderate that, or?
Yes, thank you, Dr. Lango. Yes, at this time, please enter your questions. Okay, we have one question. Is there an interview process as well?
That's a great question. We do not require interviews. However, like I said, it can be really helpful for us to kind of just add to our general knowledge of you from the materials you submit if we actually have some type of, like I said, either video conference or in-person meeting. Sometimes we will ask an applicant to go ahead and set up a video conference meeting with us to follow up on some of the questions that arise for us in reviewing your application materials. And so it is not required, but we may reach out to you, and you are always more than welcome to reach out to us.
Okay, we have another question. What type of jobs do your dual degrees graduates obtain?
So that's also a really important question as you're evaluating whether this is the right program for you. So we are just starting our second cohort, so it's hard for us to, it's hard for me to tell you too much right now about the types of jobs our graduates obtain, but I can tell you a little bit. So we have one graduate who is working in the City and County San Francisco Department of Public Health as a practice manager. And he actually has just recently taken the test for, I don't know what it is, but it's health education or something related to that, that's required for his promotion. And so it's been really great because he scored very well on that test, and he'll be able to get a promotion and do more of what he wants to do in his role as a practice manager who focuses mostly on behavioral health issues for the City and County of San Francisco. So that's one example. I have another student who has decided that she wants to pursue research, and so she is hopefully working with a researcher at one of the veteran administration's sites, focusing on mental health and substance abuse research among veterans. And so that's also really exciting. And I will just tell you anecdotally, her employer, the main researcher, was really excited when he saw she had her MPH and then she had this MSBH, and he said, wow, so you have all those public health skills and then you know about behavioral health. And that's really, in a nutshell, what the dual degree program is. That's really what you come out of the program with, these really nice generalist, data-driven focus on public health skills, but really having that additional expertise in behavioral health. Let me think if I can speak to another. Like I said, we don't have, we only have a couple of graduates yet. So, so there's, you know, I don't have much to offer in that realm yet. But we do know that with your MPH, it's one of the best degrees that you can get. It's almost becoming de rigueur now if you want to work in healthcare settings, that you have your MPH. And so then what the MSBH really does bring to the table for you is it kind of bumps you up a notch to say not only do you have those public health skills, but again, you have this additional expertise in behavioral health. And increasingly our country and our world really have recognized that behavioral health issues are they are an enormous source of illness and wellness for populations, for people. And we really need to be paying more attention to behavioral health issues because they are such a major part of the health challenges that our populations face and increasingly face, and because there is an increasing recognition that mental health and physical health are absolutely linked, and that taking a holistic approach to health in the delivery of care, in the structure of our healthcare systems, in the health education and communication and programs that we provide, that's the way forward, and that's how we're really going to improve the health of people and populations.
Okay, next question. What is the out-of-state tuition?
So there is no difference between in-state and out-of-state tuition because University of San Francisco is a private Jesuit university. The way our costs work is that you pay per unit. And so I don't know the per unit cost, but you can find that if you are on the website, you'll be able to find that when you look at finances. You can either get there from the admissions website or you can get there from the general program website. And so the program, the full program where you come out with both degrees requires about 60 units. And so you take the per unit cost, whether you're in state or out of state, and you multiply that by the unit cost. And that's how it comes out. It's expensive. You do get an excellent education. University of San Francisco is a very special place, and one of the things that's wonderful about it is that you have these experts in health and healthcare, public health, behavioral health, and nursing, and so many different areas. And we're all committed to social justice. We are all committed to working with underserved populations and really, advancing health for oftentimes people at the margins of society, people who are really underserved and really need a lot of intervention. But we are here as faculty because we love teaching. So all of your faculty also do research, but it's not our primary goal as health professionals. Our primary goal in being at USF is to be excellent teachers. And so you really get these wonderful classes because our professors love to teach. And so it's something you really have to think about. Also, many of our students, actually most of our students, work while they're completing the program. And we recognize that that's absolutely fine. And it's one of the reasons that we have our classes set up in this hybrid format where every other week is in person and every other week is online. It's also why our classes start at 5 p.m. So you won't ever have a class that starts earlier than 5 p.m. And so this works very well for working professionals because you're able to have your day job and then you're able to get to class at 5 o'clock. It can be hard to work full-time while you're in the program, in the dual degree program. It can be done. It's more stressful. And when you do your field work in particular, because you have to do your 300 hours for your internship, it can definitely be challenging. But working part-time is absolutely what the large majority of our students do.
Okay, next question. Within the first cohorts, is there a diverse range locations where students come from, as in out-of-state students accepted into the program?
Yeah, that's a great question, and you know what? We were just looking at kind of who our applicants are. So, 80% of our applicants come from California. Excuse me, but they do come from all over California. So we have a number who are from the Bay Area, but we also have students from all over California, Southern California, Northern California, the eastern part of the state, et cetera. And then the other 20% come from all over the country and all over the world. The majority of our applicants are women, and you notice that with the enrollees. Also, one of the things that we find that we are, it really contributes to the richness of the dual degree program, is our applicants are incredibly diverse. They're racially diverse, they're ethnically diverse, they come from all walks of life, and it really creates real dynamic classes and discussions, and you are special. As a dual degree student, you are closely followed. I am your program advisor. I am with you for the duration of your program. I help you set your courses up every semester. When you're having challenges, we talk about them. I check in about how everything is going. So you start with a cohort. You start in the fall. You would start next fall, and you start with that cohort. Our dual degree cohort is going to be somewhere between 12 and 18 students about. And these students become your best friends. You guys go through your classes together, you spend a lot of time together, we do a lot of teamwork and team projects across all of your classes, and you really get to know your cohort. And it's really wonderful because these are your peers who are as passionate about behavioral health issues and public health as you are. And so it's really this incredible environment because there's so much energy, and here you are with people who are committed and concerned and trying to figure out how to address the same health issues, the same mental health, physical health, holistic health issues healthcare issues that you are committed to addressing. And so your cohort will become your best friends, and it's a really kind of wonderful way to do graduate school, because you have your faculty who are there to teach, who want to make sure you have an excellent student learning experience, and that you're well equipped when you graduate to be a very competent public and behavioral health professional, and you also have your peer cohort that you are moving through the program with and tackling issues together.
Okay, next question. What are the requirements as an international student to apply to this program? I may want to refer to Tamara White. Right?
Yeah, I think that's a great idea. So that's a question for our admissions team. They're a little bit different, and you might have questions about your transcript or different things like that. So do contact our admissions team, and you want to contact Tamara White, who you can see her contact information on the webinar screen.
Next question. I took my psychology classes and statistics 10 years ago, but recently graduated from the MSN-CNL program.
Yes, okay.
Okay, and that was the end of the question.
Oh, so okay. So you know that. Thank you for pointing that out, because I forgot to mention this when we were talking about admissions. So you need to have, for your admissions, you need to have taken a class in psychology and a class in statistics. All right. We do require those for your application. Now, sometimes students will say, "Oh, can I take those classes over the summer before I start the program?" And we generally say yes to that, right? But you do have to complete them, and we have to have proof of completion before you actually start the program in the fall, okay? So if you took psychology 10 years ago, it counts. We don't have a term limit on how long, how recent that has to be. However, you may decide that you actually want to kind of update, brush up a little bit on your knowledge of psychology, because it'll help you in your classes, and it'll make your whole learning experience in the dual degree program that much better. But you don't have to. If you can show you've taken psychology on your transcript from more than 10 years ago, then that absolutely suffices.
Next question. I don't live in San Francisco. Do you know how much of this program can be completed online?
So like I said, what's most important for you to think about if you don't live in San Francisco and you don't intend to move to San Francisco, is you need to be able to be in San Francisco in person in classes starting at 5 p.m. 1 to 2 nights every single week. Okay. Now, like I said, we are flexible in the format of the classes, and some of your particularly your public health classes can be taken online, but it's still going to, you will still need to be able to be in San Francisco, let's say at least once every 2 weeks, to take your behavioral health classes or public health classes that are not available online. So you do have more flexibility, like I said, in taking and the ability to take some classes online. But if you want to talk a little bit more about how that might work and what you're able to do and what your limitations there are, go ahead and email me, and we can set up a time to talk about that more in depth, like how that might work. Okay.
Next question. I'm an RN at an inpatient psychiatric hospital. Would I be able to complete fieldwork hours at my hospital?
Oh, thank you for asking that question. So sometimes students will say, I want to do my fieldwork at my current place of employment. It's more convenient, the setting, et cetera. And so the answer to that is yes, you can complete your fieldwork, those 300 hours, at your current place of employment. However, 2 main points here. First of all, you have to be focused on a project that would not be part of your day-to-day job. So it has to be a new area for you, because the goal of fieldwork, it's learning, right? And so if you do work at your current place of employment, you need to be in a different area or a different department. For your fieldwork, you must have what we call an on-site preceptor. So that's kind of your mentor who's at your agency, who you're working very, very closely with. We work very closely with you too at USF, but at your agency, employee at your field site, you have to have a preceptor. And so we would want that person to be someone that you don't normally interact with or work with on a daily basis, so that it's a very new experience for you, and also that that they don't consider you an employee, because that's one of the challenges that we find when you complete your field work at your current place of employment. They're so used to thinking of you as an employee, and yet you're not. In field work, you're there as a student, and your main goal is learning. And so it can be tricky, which is why we really ask that you're doing something separate and you're working with a person or a new group of people who you haven't worked with in the past, so that there really is that learning, and it's clear that you're a student and not an employee. And so we, when it's time to start thinking about field work, then that's something that we'll get more into with you. But yes, you can complete your field work in your place of employment. You don't want to make that decision when you start the program, though, because you might decide that, there is some other place. You've always wanted to work in some voluntary health agency in San Francisco, or there's a certain population that you've always wanted to work with, or you just want to do something different. And so sometimes, you come into the program thinking, oh, I'm going to do my fieldwork at my place of employment, but you decide at some point in the program that actually you're not going to do that. You want a whole different setting for your fieldwork. But great question. Thank you for raising that.
Next question. How this program will help me as a biochemist?
As a biochemist. So that's one that I think you and I should talk separately. I need to hear a little bit more about why why this program is attractive to you, and what you want to do once you have completed the dual degree program and you have your MPH and MSBH. I assume that you're interested in health, and maybe you've decided that the work you've been doing as a biochemist is not the type of work you want to be doing. You want to be working more with people, or you want to be working more with systems of healthcare delivery. So you want to be in a different area of health. And so that's what, those are the types of skills and content knowledge that you're going to gain from the program. But I'm more than happy to talk about that with you in a different conversation. So just email me.
Next question. How many students are accepted into the program?
Oh, that is a good question, and I don't know the answer. Like I said, we aim to enroll about 12 to 18 students each for the fall, and so that means that we will aim to accept about 30 total students. No, that's not right. We will aim to accept about 20 total students, and so it really depends on how many applications we get. And this will be the third year. Y'all would be a part of the third cohort that starts next fall. And so we don't have that much data, but like I said, we do aim to have between about 12 to 18 students in your cohort. And so, there is some competition, but what we generally find is that the applicants to the dual degree program, they're very focused. And so in terms of evaluating that fit, most of the time we find that a student only decides to apply if they're pretty sure this is the right fit for them, and usually we agree with that. And so then it becomes, just us really evaluating, your ability to succeed as a student in the program. So I hope that helps a little bit.
Next question. Does the prerequisites expire or has a expiration date?
So that's kind of the question we got just a few minutes ago. So no, so we do not put a term limit and expiration date on how long ago you have to have, or within what time period you had to take psychology and statistics. So of course it's better if it's more recent, it's more fresh for you, and you will be required to take biostatistics, epidemiology, and research methods. And so having had statistics, more recently, it sets you up better for having an easier time with those types of research and data-focused classes. But again, it's as long as it's on your transcript somewhere, no matter how long ago, then you have met the requirement. But you may just decide that you need to kind of brush up on kind of those basic psychology and statistics skills, because you will be called to use those many times throughout your coursework.
Next question. Do you offer scholarship?
So we do have some scholarships. When you, there is, I think we have a finance page. You can ask the admissions team if you'd like. You can email Tamara, but I'm pretty sure that it's pretty easy to find on our website. But if you have a problem, then do ask Tamara about that, and she can direct you in the right place. So there's a couple of different scholarships that are available to students in the School of Nursing and Health Professions. And then we do provide some small scholarships to individual students, and if you're accepted, then you will be sent information about how to apply for those individual scholarships that we offer to students across our population health sciences programs.
Next question. Do you accept credit cards from relevant graduate coursework that was completed prior to entry to this program?
So do we accept credit for relevant classes that may have been completed? We do. We do have a limit. It's actually, the university has a policy in place about how much credit can be brought in, right, and substituted for required classes in your graduate program. And so I believe that you can bring in up to 8 credits, and those would be, essentially you'd have to take 8 credits fewer, but that'll have to be worked out with your program advisor, with me as your program advisor, and we would look at those classes and ideally look at the syllabus for each one of those classes that you'd like to have substitute or count for credit. But we're definitely open to that because we don't want you to, have to take classes twice essentially. But up to, I think it's up to about 8 credits. But we can confirm that, if you, as the admissions process continues, right? But you can bring in 1 or 2, usually it comes out to about 1 or 2 classes. And we have students who will waive classes like project management or I'm trying to think what other kinds of classes. Rarely are you going to waive your core courses, but sometimes you will be able to do that.
Okay, I think we have time for one more question, so I'm going to ask this question and combine it with another. So the question is, do the organizations for fieldwork have to be in the city of San Francisco? And the other question is, can research count as the 300 hours?
Okay, so let me answer the second question first. So yes, so you can definitely work on a research project as long as it has a behavior focus to it, right, for your field work. And that's actually that's an exciting opportunity, I think, that is a really neat way to kind of do your field work in the dual degree program, because those research skills are so important in public health. The focus on data is so important on public health, so important in public health. And in fact, when you graduate with your MPH, a lot of times that's one of the skill sets you have that employers are most excited about, your ability to handle data. So that research setting gives you that focus on public health, and then to have your research project be focused on behavioral health issues is really, really exciting. So absolutely, that there are all kinds of combinations there, but an opportunity. So yes, you absolutely could have a research-focused fieldwork, site setting, and capstone project. In terms of, can you do your fieldwork outside of the Bay Area? So I don't have a definitive answer to that question. We have yet to have a student who has done fieldwork for the dual degree program outside of the Bay Area. Several of our students have came into the program thinking they'd do that, but then ended up deciding that logistically, with coursework, it was just more feasible for them to do their fieldwork in San Francisco. So, so it's possible, and if that is something that you're really committed to, then we'll figure out how to make that work. So I hope that helps a little bit.
Well, thank you everyone for joining our info session today. If you want, we have recorded this session, so if you want to go back and listen to it again, check back in about a week to the dual degree website, and we should have this link posted.
And thank you, everyone.